Hi, this is Koby Taylor with Fusion Pharmacy and Awoke Wellness, and I wanted to come to you today to talk about a topic that I'm really passionate about. I'm super excited to be able to talk to you about some of my favorite things to help with allergies and sinus relief, and to talk about some things that you probably have heard of and maybe some things you haven't heard of. And hopefully today we can kind of go through some of the therapies I hope to highlight and kind of give you kind of how to use them and kind of how they could maybe fit in, make your life better so you can breathe a little bit better. So we all have experienced sneezing or itching or runny eyes or itchy eyes. These symptoms are miserable. This last allergy season was one of the very worst. I saw a lot of people really struggling with environmental allergies this spring, and they can make people miserable and make it difficult to sleep and make it difficult for you to get your job done. So, and whether that's being caused by, for me personally, I have cantaloupe allergy and mango allergy. So those are my food allergies that I have to avoid. And I struggle with when the cottonwood trees flow. So everybody's kind of got their things, and some people know what their allergen is, and other people haven't figured it out because it may be a mold or a fungus or some other thing that's triggering an allergic response and can cause chronic sinusitis where you get inflamed sinuses and may plug up or not drain appropriately, and that can cause pressure and pain and headaches and create some of these other symptoms. And we see people present with a whole host of different symptoms and they're miserable. And so whether that's snoring or itchy eyes, runny nose again, sometimes it's just even a sore throat. So, and you don't realize that those sinuses are draining and irritating the throat and can cause you to lose your voice and can even be a chronic problem. So some of the traditional pharmaceuticals that we see that are commonly used are categories of antihistamines, decongestants, corticosteroids, nasal statins. A lot of those are used topically. And then we have some more not as traditional, and I'll kind of talk about each one of those a little bit. This slide just kind of illustrates some of the things that are on the market that we see commonly that go topically in the nose, except for the silver. But this is a nasal and mast cell stabilizer. Some people will find some relief with that. Xlear is just a rinser. It has some xylitol and an antibacterial property. Ocean is just a branded saline, and it's used sometimes in kids. And then Afrin is a nasal decongestant. Those you do need to be careful with. They can cause rebound congestion, so you don't want to use that for more than 5 days, and you will often have to kind of wean off of it. And so if you get stuck in that cycle, a lot of people use it, it gives them relief, and then the congestion comes back, and it's the medicine that's causing some of that as well. So you do have to be careful with how much you use that. Antihistamines are the other one that we see a lot. So you see somebody taking an oral antihistamine like Claritin or Allegra or Zyrtec, and we see a lot of these being prescribed, and a lot of them have gone over the counter as well, so you can buy them in both ways. And then sometimes it is less expensive to buy it as a prescription. So it's important to ask us if maybe you can get something cheaper even as a prescription. The eye drops, a lot of those have gone over the counter as well. That's a topical antihistamine, and I actually prefer this method when it comes to an antihistamine. It helps get the medicine right to where it goes. It does give instant relief, and it does seem to be more effective, at least for me personally, and a lot of other patients that I serve, to actually help with the itchy eyes and kind of actually eliminating those. So, and there are both prescription and non-prescription. Some of the over-the-counters are more sedating than others, and so it kind of just depends on you and kind of what works best for you. Nasal steroids, there's 4 that have gone over the counter now. So Flonase, Rhinocort, Nasonex, and Nasacort are all over the counter. They often are, you can get a generic Flonase, usually cheaper as a prescription. So if you can get a doctor to write for that, then that might be a way to go. They do work better to be used kind of on a daily basis, so it's something that you kind of need to do all the time. They do help. If used daily or twice daily, they can be used seasonally or they can be used long term. I do think that it's important that you realize that when you use those in the nose, that you sometimes can use like a V shape, so you're actually spraying to the angles rather than directly up in, or even on the septum. You kind of want to try to hit different ways and angle it the right way. We do see I see people use these a lot, but they do work better to use kind of on a regular basis. So you're doing it on every single day, and it kind of builds up and helps with symptoms. It does help with runny nose, but it also helps with itchy eyes for a lot of people. And some of them, too, people will say that they taste it, so it's a different taste, or it's going down the throat. Often that is because you've sprayed it in. If you spray it in that V shape, you get less of that down the throat, and it's often getting the medicine where it needs to go. So, sinus rinse products. These are great, and they both come in. I'm going to talk about large volume rinses. There's a couple of products like the Nasoneb product. This is very popular, so the large volume rinse. You would use salt water, so you could use either a pre-made salt water. You could do distilled water. That's actually probably the best in mixing with a salt packet that's already pre-made. You can make your own solutions with salt and baking soda to kind of make your own if you want to do that as well. You can rinse these and even wash them with soap and water to clean them. It does go, there's a couple of different methods for actually using these products. You can go in the nostril and you squeeze. You don't want to squeeze overly too hard because you don't want to get too much into the sinus cavities, and that can cause pressure. So initially, especially initially when you're trying, you want to kind of go slow. A lot of people will have it go in and come out the other sinus, or the other nair, or the other nostril. That doesn't always happen, especially if you're extremely congested the first time, so it might go in one and come back out the other. Usually they're 240 ml, so you do half of a bottle, and then you repeat and do the other side with the other half. And so it's a great way to kind of rinse. This is a neti pot. There's lots of different ones. You can buy ceramic ones of different kinds, but again, it's usually used as you tilt over a sink, placed in the nostril, and it kind of goes in and over to the other side. Also has pre-made packets as well. And then we have a branded, the kind of Rhino. It's just a different bottle, a little different device. They also have a pre-made packet as well. And often we find that that's very soothing in helping rinse nostrils, large volume things. We do a lot of compounds as well, so you can actually do prescription medications and deliver things that way as well. So you can do a steroid, a nasal steroid, or you can do an antibiotic. So if you don't want to take something orally, a lot of times we can deliver it topically, and we can get the sinus infection cleared out if we need to. We can even do antifungals, and sometimes we even do maintenance things, like you might do an antihistamine, or you might do a mast cell stabilizer, those same things that are in other products, but we're doing it in combination. And in some cases, insurances will cover those things, but we can usually come up with a very reasonable therapy to add to these products to the bottle and help you rinse in a sinus infection or that type of state. So they're a great way to kind of deliver and rinse a lot of ways. There are different methods in doing it. So most people will kind of tilt over, but kind of depending on which sinus cavity you're trying to rinse, you may find that you get better results by moving and tilting, and even moving your head back in some cases. That's often more uncomfortable and more difficult to do, and a lot of patients don't like to do that, but it certainly is a method that is possible. This particular product is a simple saline. It's just a salt rinse. This product helps rinse kind of on the go. So it's already pre-mixed, so it's really handy. You do have to be careful with the tip, that you don't get that too far up your nose, but and it doesn't usually rinse with as large of a volume, but in travel or on the go, it is a reasonable thing to kind of have. So the other product that I wanted to talk about is a Nasoneb. This particular device is really handy. It is something, and it's not as large of a volume. It is a great way to deliver, that we use to deliver medications. So you can see that it's got a nasal cannula. It does go in one nostril, and it rinses, and often will come out the other side and sometimes back down. Most people will tilt over a sink as they do it. The main thing is to keep it from spraying in your face. You want to, let me just kind of walk through. So you do salt water, If you have some prescription medication, we might have a medication mixed in there that we want to deliver to your sinuses. And then what I have people do is, I'm gonna place that on. Keep your finger kind of on the on-off switch, and when you go, you can see that it kind of sprays pretty high up in the air, about 3 feet in the air. So it is rinsing. It works really great for frontal sinuses. For me personally, I really like this device. It's been a game changer for me and my allergies and sinus issues. And I rinse, and I often rinse just with salt water, but when I do have an infection or other things going on, I can add medications into it, and that can help clear. So the main thing is to keep your finger on the button so that you can turn it off if you feel uncomfortable or you need to blow your nose or kind of rinse. Most of the rinses are all done that way, where we do see that as you're rinsing, you kind of want to blow and clear and then kind of rinse again. So, and they're very customizable, kind of what works best for you. And we can help educate or teach you how to use any of these devices so you can clean. But if you think about allergens that are going to get up in there, or infections and things like that, if you can get things to move and you can get your tissues to become less inflamed, you can see huge improvements in your overall satisfaction. I have seen the Nasoneb with somebody who is not been able to smell, so they've lost a lot of their sense of smell. That olfactory nerve sits on the top of that sinus cavity, and if you can shrink those membranes down, oftentimes smell will return, and so you can taste your food better, smell better, and just generally even sleeping better, and some of those nighttime things can really be, you can see significant improvements if you can do that. Even in a common cold, I often can see somebody rinsing just to clean out all that mucus and get things moving, and they can sleep a lot better once you do that. So I love this therapy. For me, this is a fantastic therapy, and it is really, it's over the counter even, so you can buy the machine without a prescription, and you can start rinsing with salt water right away. I did want to talk about, there's a couple other products I just kind of wanted to highlight. So this particular product is an over-the-counter called D-Hist and D-Hist Junior. These are a multivitamin. I have found this to be very effective in helping prevent the release of histamine. So it helps you with your kind of that allergic response. And it has quercetin, stinging nettle, bromelain, and N-acetylcysteine. And they kind of work in combination to kind of help clear toxins and move things and kind of help your overall immune system. So I've seen great improvements personally by using this, and it has helped a lot with like common allergens. So great products, and if you have more questions, I would love to talk to you about those as well. This particular product is, well, I guess before I go to that, I didn't really touch on this, the nanosilver. I do sometimes see this used topically to help with itching, so especially like on the eyelids, and so I will spray or use a Q-tip and kind of put it on the outer skin around the eyes that are just really itchy and irritated, and I've seen a lot of help. It helped a lot for that as well. Allergy Easy. So you've had the opportunity to listen to Dr. Agron and talk about Allergy Easy, and I just kind of want to talk about my personal experience with this product. It is this is the titration dose, so this is kind of like helping us get up. It has several different vials, and each one gets stronger. We have one of these for food, and we have one for environmental allergens. What it does, we just titrate up, so it's not really low doses. It's a sublingual, it goes underneath the tongue, and it just helps you build up a tolerance. So a lot of people have heard of an allergy shot. This is just a different way to deliver it in a daily drop. And it's been a game changer for me. I've actually been able to eat a little bit of cantaloupe and not trigger the immune response that I used to have. So that's really exciting. I have my son who's on it as well, who has a peanut allergy, and he is been about 9 months that he's been on it, and he can be around it and not trigger. Before somebody could breathe on him with Nutella, and he would set off a reaction. Many visits to the ER to get him and doing EpiPens and things like that, and it has made it so he can tolerate a little bit, and we're hopeful that eventually he can, if he accidentally eats some, that he just doesn't go into full anaphylactic, but at least minimizes or makes it so we don't have to do an EpiPen shot or go to the ER. So that is the goal, and it does take time to kind of build up the tolerance to that, but I've seen really good results. This last spring for me, I'm doing both the food and the environmental, and I'm seeing improvements in both of those, and my tolerance to those things is way better. And this spring was really good for me, where a lot of people, friends, were really suffering this year worse than normal. So I feel like it's really helped me, and I really like the product. And then once you get kind of titrated up, you go on to maintenance, and then that's kind of how it is. So with any of these things, we would love to talk to you about solutions to help you get rid of the allergies and the sinus problems that you're struggling with, and just make your life overall better. And so whether it's a compounded prescription, or it's a traditional prescription, or it's maybe one of these alternative therapies, I would love to talk to you more in detail. So book now, call in, get a consult with me or any of my staff, and I look forward to talking to you. Thank you.